For the first time in nearly 2 months, the United States is averaging more than 100,000 new coronavirus cases a day. This comes as roughly one-third of states have now detected the new variant, Omicron. John Yang has our report.
Delta continues to be the most dominant COVID variant, both in the United States and around the world. But with overall cases on the rise, questions abound about the Omicron variant. Caitlin Jetelina is an epidemiologist at the University of Texas Health Science Center's School of Public Health in Dallas, and she writes Your Local Epidemiologist on Substack. Caitlin Jetelina, thanks so much for joining us. First off, given what we know about Omicron, and maybe more importantly, what we don't know, how concerned should people be about it in America?
Yeah, what we do know is concerning, but we also don't know a lot. And I think that there's a lot of hope that we don't want to lose at the same time. And so there's this balance between let's wait to see what the science is going to say and continue to be vigilant because, like you said, our house is already on fire right now with Delta, and we really need to address that threat right now.
Today, Mayor Bill de Blasio in New York announced a vaccine mandate for private employers. What do you think of that step?
I think it's the right step. Vaccines do a lot. They reduce transmission. We have a lot of reason to believe that boosters will play a significant role against Omicron. But vaccines aren't going to do it all. It's not going to be, the magic ticket. It's going to be a combination of public health mitigation measures, which includes rapid antigen testing, it includes ventilating spaces, and includes wearing good masks indoors.
How likely, we had this sort of concern when the Delta variant emerged, and now the Omicron variant is emerging. Are we going to continue to see this virus transmute itself, create different variants? And how should we be thinking about this? Or how should we be worrying about them as they arise?
Yeah, you're right. This is going to continue to mutate. Viruses mutate. We expect this, especially with high transmission rates right now. The more opportunity we give this virus to jump from person to person, the more it is going to mutate and more it's going to change. I think what we need to understand is the direction that it's changing, as well as the severity and how well our vaccines continue to hold up against these changes. At the same time, have solutions in case they don't. For example, the vaccine manufacturers are on top of it, creating an Omicron specific vaccine in the off chance that we do need it. And so, really being a proactive game rather than reactive and staying educated on how this is changing and why.
On your blog, you take a lot of questions from your readers. We've asked our viewers to submit some questions, and we want to put them to you. Dan Pat from Sarasota, Florida. I am fully vaccinated. Am I more, less, or the same at risk of getting COVID because of the Omicron variant? And if I do contract this variant, am I more, less, or the same risk of spreading the virus?
That's a really good question, and he's not going to like my answer because we don't know yet. I think that if he is not if he's not boosted, he certainly should go get a booster. We have reason to believe that a booster will broaden the protection, not just against Delta, but also other variants of concern like Omicron. We think our hypothesis is that we're going to have a lot more breakthrough cases with Omicron, but we are optimistic that those with the boosted will have a less likelihood of severe disease and death. Like I said, we don't know the data yet. We should be expecting it to come within the next week or so.
And then we have from Kathy Webb in Ames, Iowa. We're, of course, approaching the holiday season when a lot of people are going to be traveling. She just simply asks, is it safe to travel?
Yeah, if you're fully vaccinated, if you're boosted, if you wear a really good mask, and I'm talking N95s, you should be very confident in that, protection bubble you have around you. Thankfully, also airlines are still requiring masks. They are enforcing masks as well. So I'm really not concerned about the airplane specifically. I would be more worried about exposure getting to and from the airplane. And this is really where you need to distance yourself, continue to wear a mask, and remain vigilant. But then once you land wherever you're going before your Christmas break, do rapid antigen tests. Use that as a quote unquote day pass to make sure that everyone that's at that holiday family gathering is as safe as possible.
Along those same lines, Dr. Fauci said yesterday that they may lift the South Africa travel ban on visitors coming into the United States. And just today, the CDC stepped up its advisory against travel, Americans traveling to more places like France and Portugal. Overall, what do you think of these travel advisories and bans, both coming and going?
Yeah, travel bans to a few select countries is not a public health evidence-based policy. It just doesn't work really well. It would work great if we shut down all borders, but we didn't do that, and we are a bit delayed. Omicron right now is in 49 different countries. And so, yeah, we may slow down spread, maybe seeds from South Africa, but that doesn't mean it's not coming other places. And so, what that means to me is that our response on the ground in the United States really needs to be proactive with testing and vaccines.
Now from Michelle Joyce in Eugene, Oregon. She says, I'm a parent and I'm very concerned to hear that there has been an increase in child hospitalizations in South Africa for children under 5. Is this variant more dangerous for kids?
Yeah, I'm a parent of 2 under 2 as well. And so I've been paying really close attention to this. And that is true. It looks like Omicron, kids with Omicron are going to the hospital at higher rates than with Delta. But it's really important to realize that we don't know why yet. But I think it's really important to keep in mind that what happens in one country doesn't necessarily happen in others. The landscapes are very different. Vaccination rates, behaviors, environments, genetics. And so we need to track the epidemiological data on the ground in the United States to ensure that this is a generalizable signal.
And from Caitlin Jeffers in Los Angeles, how likely is it for someone with natural antibodies post-COVID infection to be reinfected with the Omicron variant?
So this is actually the one piece of solid scientific data we've gotten so far with Omicron. It came out about 2 or 3 days ago, and it was not very great. It showed that a reinfection rate with Omicron is about 3 times higher than with Delta. And so, in other words, infection-induced immunity is not doing a great job at stopping Omicron. And this is really why the WHO, the CDC, and every epidemiologist I know is recommending vaccinations right now, especially boosters.
Caitlin Gentilina, your neighborhood epidemiologist, thank you very much.
Thanks for having me.